Welcome to the About Mansfield Consumer Advice Series. I'm your host, Steve Casillo. I appreciate you being here today, listening on your favorite podcast platform. And today we're actually starting a brand new series. We've done chiropractic in the past, if you've been around with us since January, but this time, instead of Dr. Joseph Adams, we're doing this with Dr. Jordan Adams. And today specifically talking about chiropractic care for expecting mothers. Hope you enjoy it. Sit back, relax. Here we go. Well, if it's Wednesday morning, it must be time for the About Mansfield Consumer Advice Series. I'm Steve Casillo. I appreciate you being here today. You are either watching live on Facebook, watching the video on YouTube, you could be watching the video on LinkedIn, or you could be listening to the podcast on whatever your favorite podcast platform is. In any event, we appreciate you being here today. And today, we're starting a new chiropractic series, and that is with Dr. Jordan Adams. Welcome to About Mansfield.
Hi.
Now, and since this is your this is your first time here on the Consumer Advice Series, what I wanted to do is just kind of take the Reader's Digest version of who is Jordan Adams and give us a little who, what, when, where, and why about you, and then we'll get into our topic.
So I'm a chiropractor here in Mansfield. I've actually been in Mansfield, for about 15 years or so. I graduated Mansfield High. So it just felt like a good place to come back to, a great community. But how I got into chiropractic was I was teaching yoga and working finance at the time. I actually didn't know anything about chiropractic, but I had a friend who pulled me aside and he was just explaining, hey, you love yoga so much and you love the philosophy of wellness and health. You really should look into chiropractic. So I did. I took his advice and I toured Parker University. It's right up here in Dallas. I just fell in love with it. I fell in love with the concepts. I fell in love with holistic care. I fell in love with helping people approach health from an empowering standpoint. And even more so, I fell in love with helping pregnant moms approach pregnancy and health for their children and their family from an empowering, holistic mindset. And so my journey really evolved through my own pregnancy journeys and raising two young kids and yoga. So it's been kind of a full spectrum experience.
And helping pregnant moms, expecting moms, that this is the topic of today. And so let's start with the impact of chiropractic care and you now have two kids. Let's talk about your pregnancy journey and how chiropractic care helped you and your babies get a healthy start on life.
Yes. So like most moms, I was actually a little terrified of going through pregnancy and going through birth. But after educating myself and learning more about, honestly, like our bodies are designed to have babies, I found this sense of empowerment through pregnancy and through birth. And what's really interesting is that chiropractic care can help women have a more comfortable pregnancy, a more efficient birth experience, and a faster recovery postpartum, which is all really, really important for making sure that you're functioning as your best self from preconception through pregnancy, through delivery, and postpartum. So for me, I felt like it gave me peace. It gave me comfort. It gave me understanding. And I was able to have two natural water births, which prior to chiropractic, prior to my own journeys, I never thought I would have wanted to do or been able to do.
And describe because I have two kids, they were both born in a hospital. And so what is a natural water birth?
So a lot of times you'll see this in either a birthing center or some hospitals who have taken midwives on staff with them. But what essentially you're doing is you're using a birthing pool or a water to help facilitate more comfort and ease during labor. And some women will even give birth in the water. That's what I did with my two kids. Sometimes you'll just sit in the tub before birth, but to help with contractions. So you're just using water to have more ease during labor.
Yeah. An expecting mother is seeking some additional care. What might a pregnant mother seek in terms of care out of your office?
Most of the time, we see pregnant moms usually around 20 to 30 weeks pregnant for a number of reasons. Either they are having really bad back pain because as pregnancy progresses, your posture adapts, and that can create increased curvature of the low back. It can cause muscle dysfunction. It can cause SI joint dysfunction, really any number of things. Ideally, what I like to see is women starting their chiropractic care early on in pregnancy. So not waiting until they're 20, 30 weeks pregnant, but coming in either before they want to get pregnant or when they find out they're pregnant, so that we can prevent those later on aches and pains from happening. But most of the time, a lot of them come in because they are in pain. They want out of pain.
I would assume the additional weight of not only the baby, but then also the amniotic fluid there's a lot of wear and tear on the spine.
The average pregnancy, you should be gaining anywhere from 25 to 35 pounds.
Yeah.
And this happens very quickly. So it's a lot of stress on the body, particularly at the end of the second trimester through the third trimester, when your weight tends to pick up rapidly because baby grows more rapidly in those last several months.
You not only see expecting mothers, but then after they've given birth, you also do provide chiropractic care for babies. Explain what that process is.
So I love working with newborns and with babies. And I just want to start off by saying what we think of when we think of chiropractic care for adults isn't how we treat babies. So when we treat babies, we're using very light pressure, like we would check an avocado for ripeness or a tomato for ripeness, just very light sustained pressure, almost like a massage. And it doesn't look like I'm doing much, but a lot of times moms struggle with either their baby is just unusually fussy, like colic, or they're having a hard time nursing, ear infections. There's a lot of things that can happen early on that can come from structural stress on the spine from birth, whether birth was fast and easy or it was a little more difficult, or we had to have interventions like a cesarean birth. Trauma can happen regardless.
Sure.
So that's one thing I check for. The other thing is nervous system dysregulation can be a huge thing with newborns that people just don't talk about. And that can be a contributing component to things like colic or fussiness that needs to be addressed. So typically I always tell my moms, if you want baby checked early on in those first 5 days, I'm here for you, and we'll get your baby off to the best start in life.
So you're not bending and when I think of chiropractic care, which I actually love being adjusted, because you just feel so the relief of tension after the I'm going to use one of your words, the subluxation has gone away. When you've had the spine adjusted, it's a tremendous feeling, but that's not what you're doing with babies.
Not at all. Very gentle, very safe.
If there is an expecting mother out there in Mansfield or in the Mansfield area who is watching this or listening to this and has more questions about chiropractic care, how can they reach out to Dr. Jordan Adams?
So the best way is all of our contact information is on our website. It's at calibrationmansfield.com, or our number directly to our office is 817-779-3435.
That's Dr. Jordan Adams, and there you go. You just did your first episode right here on About Mansfield. We'll do this again next week.
Thank you.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.